Today, we're diving into how addiction and mental health are deeply connected. Addiction is rarely just about the substance or the behavior itself. For many people, it's a way to cope with anxiety, depression, trauma, or other mental health struggles. It can feel like a solution in the moment, but over time, it often makes things worse. Whether it's drinking to calm social anxiety, using stimulants to cope with ADHD, or turning to substances to numb the pain of PTSD, these patterns can create a cycle that's hard to break. In this episode, we're going to explore some of the most common co-occurring mental health conditions that come with addictions, like anxiety, depression, PTSD, and more, and how they can fuel addiction. More importantly, we're going to talk about why treating both at the same time, what's known as dual diagnosis treatment, gives people the best chance at recovery. If you or someone you love has struggled with addiction, today's episode will help you understand the deeper layers behind it and why healing isn't just about quitting a substance, but also about addressing what's underneath. So let's get started. Welcome to the Codependent Doctor, a weekly podcast focusing on all things codependency. Are you struggling to love yourself, feeling burnt out, or having trouble forming loving and meaningful relationships? I can help you heal from the past and move forward with healthier selves, healthier relationships, and healthier, more fulfilling lives. Join me as we reclaim your authentic self. I'm your host, a family doctor and fellow codependent, Dr. Angela Downey. We can do this together. Here we go. Hello to all my wonderful podcast listeners, and welcome to the 33rd episode of the Codependent Doctor. I'm your host, Dr. Angela Downey, a family doctor and fellow codependent. Today's episode is going to focus on the different co-occurring disorders that often accompany addictions. This is the fifth and final episode of my miniseries Addictions. I can't believe how fast that went. If you have any suggestions for other miniseries or episode topics you'd like me to address, I'd love to hear from you at codependentdoctor@gmail.com. When someone struggles with addiction, whether to a substance or a behavior, it's common to find other challenges beneath the surface. Many people come from codependent backgrounds, but beyond that, addiction often exists alongside mental health conditions. People may turn to substances or compulsive behaviors as a way to cope with anxiety, depression, PTSD, bipolar disorder, OCD, ADHD, borderline personality disorder, or eating disorders. As I've emphasized throughout the series, addiction is complex and shaped by biological, psychological, and environmental factors. It can be difficult to untangle the connections. Does addiction fuel codependency, or does codependency contribute to a mental health condition that then fuels addiction? Or does codependency directly feed into addiction, making mental health struggles even worse? The truth is, everyone's journey is different, and it's shaped by their upbringing, their genetics, and personal experiences. If you've been following my podcast, you know that I've covered codependency and how to break free from patterns that no longer serve you. In this mini-series on addictions, we've explored different types of addictions and paths to recovery. Today, I'm going to focus on the mental health conditions that often go hand in hand with addictions. If you recognize yourself in any of these, I strongly encourage you to speak with your family doctor or a mental health professional. Addressing these co-occurring conditions can be a key part of achieving lasting recovery. The first mental health condition that I wanted to discuss is anxiety disorders. Approximately 50% of people with a substance use disorder also experiences an anxiety disorder, and this can complicate treatment. It can often lead to higher relapse rates and more severe symptoms. Many people turn to substances or compulsive behaviors to manage their anxiety, but this can quickly spiral into a cycle of dependence. Whether it's drinking to feel more confident, using drugs to calm racing thoughts, or turning to compulsive behaviors like gambling or binge eating to distract from worry. These short-term fixes often lead to lifelong problems. Anxiety can feel overwhelming. It's that constant worrying, the racing heart sensation, or that sense of panic that just won't go away. Instead of facing the discomfort, many people are looking for ways to numb it. If you have social anxiety, being in a room full of people might make you nervous. You overthink every conversation and worry about embarrassing yourself. So you start drinking to loosen up a little. At first, it seems to help. You feel more relaxed and talkative. But over time, you might start depending on alcohol in social situations, making it harder to feel comfortable without it. Someone with generalized anxiety disorder might feel constantly on edge. So to cope, they start smoking or using marijuana daily to take the edge off. This creates a tolerance, meaning that they need more and more to feel the same relief, and that can lead to dependence. Instead of substances, some people might turn to food, shopping, or social media scrolling to avoid their anxious thoughts. A person struggling with panic attacks, for example, might binge watch TV or shop online to avoid their fears. These behaviors can become addictive, making it hard to stop, even when they cause financial, emotional, or health problems. Codependency can fit into the mix because people with codependency often struggle with low self-worth and fear of rejection, and that can make anxiety even worse. If someone is constantly trying to please others or manage other people's emotions, they might feel chronically anxious about how they're perceived. This can lead them to use a substance or a behavior as a way to cope. An example would be a codependent person in a relationship with an addict might feel anxious all the time. They might be worried about their partner's behavior, their emotional state, or whether they're going to relapse. Instead of setting boundaries, they might drink to numb their stress or engage in compulsive caretaking behaviors to feel some form of control. Anxiety and addictions feed off of each other, making it crucial to treat both at the same time. Therapy, mindfulness, and learning healthier coping strategies like exercise, meditation, or journaling can really help with this. Recognizing the link between anxiety and addiction and codependency is the first step towards breaking free from unhealthy patterns. Depression is another disorder that we often see with addictions. Depression and addiction often go hand in hand, feeding off of each other in a way that can make both conditions worse. Many people turn to alcohol, drugs, or other addictive behaviors just to escape that feeling of sadness or feeling of hopelessness or emotional numbness. But what starts as a way to feel better can quickly spiral into dependence, and it makes depression even more severe. When you're depressed, everything feels heavy. Simple tasks can feel overwhelming, motivation is low, and negative thoughts can take over. Many people self-medicate with substances or compulsive behaviors in an attempt to lift their mood or numb their pain. A person struggling with depression might have a drink after work to take the edge off, but over time, one drink turns into several. Alcohol is a depressant, which means that while it might make you feel better in the moment, it actually slows down your brain function and it lowers your mood over time. This can lead to an even deeper depressive state, making the person want to drink more just to escape it. Some people turn to painkillers or sleeping pills to help them relax or escape their thoughts. But these substances, they alter your brain's chemistry, and it makes it harder for the brain to produce natural feel-good chemicals like serotonin and dopamine. Over time, the person relies on the drug to feel normal, which can quickly lead to dependence. Depression can cause low energy. It causes fatigue, brain fog, and some people might use something like cocaine or meth or even excessive caffeine to give themselves a temporary boost. But after the high wears off, the crash makes depression even worse, and it leads to an exhausting cycle of highs and lows. The relationship between depression and addiction isn't one-sided. Addiction can also cause depression or make existing depression worse. Substance use can disrupt the brain's natural balance of chemicals like serotonin and dopamine, which regulate your mood. Over time, this can increase your feelings of sadness or fatigue or hopelessness. Many people struggling with addiction feel ashamed or guilty about their behavior, especially if it has caused problems in the relationships or in your workplace. When someone stops using alcohol or drugs, withdrawal symptoms like irritability, fatigue, and sadness can feel just like depression, and it makes it tempting to use again just to feel better. People with depression are 2 to 4 times more likely to develop a substance use disorder compared to those who do not have depressive disorders. And the combination of depression and addiction significantly increases the risk of suicidal thoughts and behaviors. This highlights why treating both conditions together is so important. If depression is left untreated, even getting sober might not feel like enough to bring relief. People with codependency often struggle with low self-worth, guilt, and the need to take care of others. If you're in a relationship with someone who is struggling with addiction and depression, you might feel responsible for fixing them. You might neglect your own needs while trying to save them, believing that if you love them enough or do enough for them, that they're going to get better. A person in a codependent relationship with an alcoholic partner might feel like they can't leave because they worry that their partner is going to fall apart. They might make excuses for their drinking or take on extra responsibilities to keep things together. Meanwhile, they may be experiencing their own depression. They might feel trapped, exhausted, and hopeless. To truly heal, both depression and addiction need to be treated together. Therapy and support groups, medication if needed, and lifestyle changes can make a huge difference. If you're struggling with both, it's important to seek help, not just for the addiction, but for the underlying mental health struggle as well, because this mental health struggle might actually be fueling it. Post-traumatic stress disorder. For many people struggling with addiction, trauma is at the root of their pain. Whether it's childhood abuse, neglect, a violent attack, maybe an accident or combat experience, trauma can leave deep emotional scars. When these wounds aren't properly healed, people might turn to alcohol, drugs, or other addictive behaviors to numb the pain and avoid dealing with painful memories. PTSD isn't just about having bad memories. It's about the body and the brain getting stuck in survival mode. After trauma, the nervous system can become hypersensitive, and it can make people feel like they're constantly on edge. They might be easily startled or emotionally numb. Back in 2015, I rescued 2 people who were drowning. We were at Rushing River in Ontario, and I was swimming with my kids at the beach when I saw them struggling in the water. The adrenaline hit me like never before. I felt like I could lift a car if I had to. It was a father and a daughter, and they were both fighting to stay above water. I was terrified that the father, who was much bigger than me, might pull me under. When he lost consciousness, I felt a little bit of relief. I'm almost embarrassed to say, because I knew that he couldn't drag me down with him, and that I would be able to swim back to shore with any kind of resistance. Somehow, I got them both back to safety, and miraculously, we all survived. It was a life-changing experience for me, and it was one that should have been a victory, but I could never have predicted how it would have affected me long-term. Even now, when I think about that moment, my heart races and I start to panic. It's completely involuntary. Once I was driving when the memory surfaced, and before I knew it, I was speeding. I was going like 120 kilometers an hour in an 80 kilometer an hour zone. My heart was racing, and my body reacts as if I'm back in that moment, sweating, trembling, and completely on edge. I've always been a strong swimmer, but now I have panic attacks in lakes, and I often need to wear a life jacket just in case I ever have to save someone again. Even playing with my kids at the beach is difficult because I'm constantly scanning the water looking for signs of danger. And this is happening with an event that had a positive outcome, and everyone survived and everyone was good. Now, imagine if the outcome hadn't been positive. Imagine spending years running through fields full of landmines, never knowing if today is the day that you're going to get shot or have to carry a friend to safety. War veterans face years of life-threatening situations that flood their bodies with adrenaline over and over again. Or think about a child who never knows what kind of mood their parent will be in when they get home. They're walking on eggshells and bracing for the next explosion. What if you grew up wondering if tonight would be the night that someone would come into your room and take advantage of you? You never knew when they were going to come. These experiences don't just disappear. The fear and the hypervigilance, they stay with you even when the danger is gone. Your body keeps the score, and it reacts as if the trauma is happening all over again, even though you're now safe. That's the cruel reality of trauma. It rewires your brain, and it makes it incredibly hard to relax, to trust, or to let your guard down. People with PTSD might experience flashbacks and nightmares, reliving the traumatic event over and over, emotional numbness, where they feel disconnected from life and from other loved ones, Hypervigilance, constantly feeling unsafe even in normal situations. Avoidance, trying to push away anything that reminds them of the trauma. To cope, many people self-medicate with substances or compulsive behaviors. Someone with PTSD might drink heavily before bed to avoid nightmares or to temporarily escape from intrusive thoughts. Over time, their body builds a tolerance, leading to heavier drinking and dependence. Some people turn to opioids or other sedatives or stimulants to block out emotional pain. However, these substances, they can disrupt brain chemistry, making PTSD symptoms even worse when the effects wear off. Instead of using substances, some people develop workaholism or excessive gaming, binge eating, or gambling habits to keep themselves distracted from painful emotions. 44% of people with PTSD also meet the criteria for a substance use disorder. Veterans with PTSD are twice as likely to develop alcohol use disorder and 3 times more likely to develop drug use disorders compared to veterans who do not have PTSD. This shows how closely trauma and addictions are linked. Many people are using substances not because they want to, but because they feel like they have no other way to cope. Since trauma plays such a big role in addiction, recovery needs to address the underlying pain. Programs like refuge recovery or trauma-informed therapy and EDMR, which is eye movement desensitization and reprocessing, help people work through trauma in healthy ways. If you or someone that you love is struggling with both PTSD and addiction, it's important to seek help that treats both conditions together. Simply quitting the substance is not going to heal the trauma, but working through the pain in a safe and supportive environment can lead to real healing. Bipolar disorder is a condition that causes extreme mood swings, and it shifts between high-energy mania and deep depression. During manic episodes, people often feel unstoppable. They are full of energy, making impulsive decisions, and sometimes engaging in risky behaviors like spending sprees, reckless driving, or excess substance use. Then the crash comes. The depressive phase can bring overwhelming sadness and exhaustion and even thoughts of suicide. This roller coaster of emotions makes it easy to see why substances like alcohol or drugs can become a way to cope, either to calm down during mania or escape the pain of depression. Unfortunately, self-medicating this way only makes things worse, and it intensifies the mood swings and increases the risk of addiction. Imagine someone with bipolar disorder who, during a manic phase, feels invincible and drinks heavily while partying because they believe nothing can touch them. Then depression hits, they use alcohol again, this time to numb the pain and withdraw from the world. The cycle repeats, making it harder to stabilize their moods and function day to day. Treatments usually involve therapy, mood stabilizers, and a structured recovery plan that teaches healthy ways to manage emotions. Support groups and professional help can make a huge difference in breaking the addiction cycle, while it also addresses the challenges of bipolar disorder. Hey there, I'm taking a quick break to share something that I think you'll love. I love to read, but if I'm being honest, I love audiobooks even more. And since I often get asked for book recommendations on codependency and recovery, I decided to put together an easy-to-read PDF with some of my top picks. You can grab the reading list by clicking on the link in the show notes. Plus, when you sign up, you'll also get my newsletter, which is packed with valuable resources for your recovery journey. If you're not into the reading list, but you still want the newsletter, then there's no problem. There's a link for that too. I hope you find some great reads in there. Now, let's get back to the episode. People with ADHD, attention deficit disorder, often struggle with impulsivity or difficulty focusing and emotional regulation, which can make them more prone to addiction. The brain's reward system works differently in people with ADHD, and it leads them to seek out stimulation, sometimes in the form of a drug or alcohol, to feel more control or focused. Stimulants like cocaine, meth, or even misused ADHD medications can provide a temporary sense of clarity and energy, but they also increase the risk of dependency. Others might turn to substances like alcohol or marijuana to calm their racing thoughts, but these can worsen focus and emotional control in the long run. Someone with ADHD might struggle with completing tasks at work and feel frustrated that they can't focus. One day, they try a friend's prescription stimulant and suddenly feel productive and normal again. This quick fix can become a dangerous habit, leading to misuse and addiction. The good news is that ADHD can be managed with structured recovery programs, therapy, and non-addictive medications that help regulate focus and emotions. Cognitive behavioral therapy, or CBT, is especially helpful in teaching strategies to manage impulsivity and build healthy coping skills without turning to substances. Borderline personality disorder, or BPD, is a condition marked by intense emotions, fear of abandonment, and impulsive behaviors, which can make addiction more likely. People with BPD often feel emotions more deeply than others and might struggle with mood swings, unstable relationships, and self-destructive behaviors. To cope with overwhelming emotions like anger, sadness, or anxiety, they might turn to substances like alcohol, drugs, or even addictive behaviors like gambling or binge eating. Unfortunately, while these can provide a temporary relief, they often make emotions harder to manage in the long run and lead to a cycle of dependency. For example, someone with BPD might feel intense anxiety after a fight with a loved one. So to numb the pain, they drink heavily, feeling momentary relief. But the next day, the guilt and the shame will set in, making them feel even worse, which leads to drinking again. This self-destructive cycle can be difficult to break without proper treatment. One of the most effective therapies for BPD and addiction is dialectical behavior therapy, DBT, which helps people manage emotions, build healthy coping skills, and improve relationships without relying on substances. Learning to regulate emotions in healthier ways can make a huge difference in recovery. Obsessive-compulsive disorder, OCD, is a condition where unwanted intrusive thoughts, obsessions, lead to repetitive behaviors called compulsions in an attempt to reduce anxiety. For example, someone might feel an overwhelming fear of germs and wash their hands excessively to feel safe. These compulsions provide a temporary relief, but the anxiety always returns, and it creates a cycle that can take over a person's life. To escape the constant stress and racing thoughts, some people with OCD turn to substances like alcohol or drugs to help them feel more in control. However, this can quickly lead to dependency as they start relying on substances instead of healthier coping mechanisms. Someone with OCD might drink alcohol to quiet obsessive thoughts at night, thinking that it's going to help them relax, but over time, they need more and more alcohol to achieve the same effect, leading to addiction. The problem is that substance use can actually make OCD symptoms worse. It increases anxiety, compulsions, and then the feeling of being out of control. So instead of easing obsessive thoughts, addiction can create a new obsessive behavior, like constantly chasing the next drink or drug to avoid discomfort. The most effective treatment for OCD and addiction is cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP. This therapy helps people gradually face their fears without resorting to compulsion or substances. Medications like SSRIs also help balance brain chemistry and reduce obsessive thoughts. Building healthy routines, mindfulness practices, and learning emotional regulation techniques are key steps in breaking the cycle of OCD and addiction. Eating disorders and addictions often go hand in hand because both involve using external things like food, alcohol, or drugs to cope with emotions, stress, or feelings of low self-worth. People with eating disorders might develop rigid rules around food. They might have intense fears of gaining weight or cycles of binging and purging, all of which can create overwhelming anxiety. To manage this distress, some turn to substances like stimulants to suppress their appetite, alcohol to numb emotions, or drugs to escape body image concerns. Some people struggling with bulimia might binge eat as a way to soothe their emotions, then purge out of guilt or fear of weight gain. If they drink alcohol afterwards to relax or avoid feelings of shame, they might start relying on alcohol as part of their routine. Over time, this can turn into an addiction, making both conditions worse. Similarly, a person with anorexia might use stimulant drugs like Adderall or cocaine to control their appetite, thinking that it's going to help them stay thin. While it might seem like a solution at first, substance use can quickly spiral out of control, leading to worse mental and physical health issues. Both eating disorders and addictions require specialized treatment that focuses on healing, self-worth, emotional regulation, and healthier coping mechanisms. Therapies like cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT, can help individuals learn how to manage distress without turning to food or substances. Treatment often involves nutritional support, therapy, and medical care to rebuild both physical and emotional well-being. Self-compassion, body acceptance, and breaking the cycle of self-punishment are the key steps in the recovery process. Addiction isn't just about the substance or the behavior. It's often rooted in deeper emotional struggles, past trauma, and untreated mental health conditions. That's why recovery isn't just about quitting a substance or behavior. It's about healing the underlying wounds that fuel that addiction in the first place. When we address both addiction and mental health together, the chances of long-term recovery are much higher. This wraps up my mini-series on addiction. I hope these episodes have been helpful to shed some light on why addiction happens, how it connects to codependency, and what steps can be taken towards recovery. If you found any of this helpful, I'd love to hear from you. Whether you have any comments, questions, or ideas for future episodes, feel free to reach out at codependentdoctor@gmail.com. Your feedback helps me create content that truly resonates and supports you on your journey. Next week, we're going to be returning to our regular episodes of the Codependent Doctor, diving back into the topics that help you set boundaries, prioritize yourself, and build healthier relationships. I wish you all a great week as you learn to foster a better relationship with the most important person in your life, yourself. I'm going to meet you here next week for another episode of the Codependent Doctor, when I'm going to be talking about challenges faced by the transgender community and LGBTQ+ communities. Take care for now. Thank you for joining me, and I hope today's podcast resonated with you. Click like and subscribe so you don't miss any future episodes and to help others who might benefit. This podcast is not meant to provide medical advice and should not replace seeing your doctor for mental health concerns. If you're having a mental health crisis, please present to a hospital, call 911 or your local crisis helpline. I'll talk to you next week for another episode of the Codependent Doctor. We can do this together.